This is a pop quiz to help you identify the spinal conditions present. Looking at this photo, what condition does this young lady have? She has mild scoliosis. You can see the demonstration of the lateral curvature of her spine with the black dots. Those black dots are superficial markers to indicate the spinous process of her thoracic and lumbar vertebrae. Looking at this photo, what condition does this young man have? He has pretty significant kyphosis. We can note the kyphosis by the excessive convex thoracic spine curvature. Kyphosis is also known as round back or hunchback. The upper back or thoracic region of the spine is supposed to have a slight natural curve. This condition is very common in swimmers. Looking at this photo, what condition does this man have? This man has lordosis. Lordosis is also known as swayback. This is a condition in which the spine in the lower back has an excessive curvature. Looking at this photo, what condition does this young woman have? She has significant scoliosis. Once suspected, scoliosis can be confirmed with a diagnostic exam such as an X-ray, a spinal radiograph, CT scan, or MRI of the spine. The curve is then measured and discussed in terms of degrees. Generally, a curve is considered significant if it is greater than 25 to 30 degrees. Curves exceeding 45 to 50 degrees are considered more severe. Looking at this photo, what condition does this young man have? This man has lordosis. Hyperlordosis tends to make the buttocks appear more pronounced. In people who have significant hyperlordosis, a large gap will be visible beneath their lower back when lying on a hard surface. Other symptoms include back pain and discomfort, as well as difficulty moving in certain ways. Looking at this photo, what condition does this woman have? She too has significant scoliosis. There are several symptoms to look for to help determine if you or someone you know has scoliosis. If you notice any of these signs, you should schedule an exam with your doctor. Your shoulders are different heights. One shoulder blade is more predominant than the other. Your head is not centered directly over your pelvis. You have a raised or predominant hip. Your rib cages are at different heights. You have an uneven waist. You notice changes in the appearance or texture of the skin overlying the spine. Your entire body leans to one side. Looking at this photo, what condition does this woman have? She has severe scoliosis due to spina bifida. There are different types of scoliosis. Degenerative scoliosis is associated with arthritis and degeneration of the spine. It typically gets worse as you age. Congenital scoliosis is defined as a curvature of the spine that is a result from malformations of the vertebral element. Most of the development happens in the 3rd to 6th week in utero after conception. In spite of the opportunities for error, congenital malformations are extremely rare. Adolescent idiopathic scoliosis is the most common form in North America, affecting up to 5.2% of the population. It is often seen during or after an adolescent growth spurt. In order for a physician to diagnose and treat idiopathic scoliosis, he or she must first rule out all other causes of scoliosis. Most idiopathic curves present in adolescents are painless, gradual, and have a typical curvature pattern, a right thoracic curve, and the neurological exam is normal. Idiopathic scoliosis is much more common in females than in males. Neuromuscular scoliosis is used to describe curvature of the spine in children with disorders of the neurological system. Common categories include cerebral palsy, spina bifida, muscular dystrophy, spinal cord injuries, and so forth. This is exactly what this woman has in this picture. Spinal curves exceeding 45 to 50 degrees are considered most severe. Some people who have scoliosis that is so severe it requires surgery. Thanks to the advancements in technology, spinal fusion is much easier than it used to be and may give the person the freedom to resume normal activities. Spinal fusion is the most common surgery to correct severe scoliosis. It's typically used to correct the curves of the spine that are greater than 45 degrees or for spinal curves that haven't responded to bracing. There are generally two goals for scoliosis surgery. One, to stop the curve from worsening, and two, to correct spinal deformities. So, how did you do? Hopefully you did better than you thought you would.